Scholar. I'm a specialist in orthopedics with additional training in chiropractic, sports medicine, as well as nutritional medicine. One of the most common clinical pictures in the orthopedic practice is simple twisting with the foot, a so-called supination trauma in the upper ankle joint. It's important to differentiate between simple strains or more invasive injuries such as fractures. However, the outer ligament apparatus in this part is most frequently affected in isolation. And from its out, a total of 3 ligaments in this part. The LFTA ligament in this part is the most susceptible to injuries. After an ankle trauma, the so-called RISE rule is applied. RISE stands for rest, ice, compression, and elevation. In order to stabilize a possible ligament injury, we use supination inhibiting orthos. The splint is worn for 6 weeks. Forearm crutches are usually not necessary or only for the first few days. If there are no instabilities in the joint, full weight bearing can be done. If there's any pain, swelling, or hematoma, an appointment to the doctor is recommended. Frequent twisting can lead to chronic ligament instability. What's particularly important to me, please stay active, fit, and have fun with movement.